Mic test, mic text.
Stop. Hi, we're going to get started in 30 seconds. Okay, we got quiet even if everyone's not sitting down. That's fine. Really quiet. It is winter quiet. So, yeah, frozen quiet. Thanks to all of you for coming out tonight. It's really freaking cold out, and we expected, we're trying to figure out whether anyone would show up or whether people would stick their noses outside and say, there's no way we're coming to this thing. So,
come on, for Paul, we knew they were going to come.
Of course they would. Thanks for coming. Welcome to Tales from the Trenches. This is our best event of the month where we bring in entrepreneurs who have a fantastic range of experiences, and Rishi talks to them about what their journey has been. This is a series that we produce together with Context Media and Pritzker Group Venture Capital. So thank you very much to Context Media. Thank you very much to Pritzker Group Venture Capital. Adam is with Pritzker Group Venture Capital. If you're interested in financing your company, he's right here. Tonight we have Paul Magelli, who's the CEO of Appervita. And Paul, I've gotten to know over the last few years. Paul was actually very helpful in the initial ideation, a lot of the initial work around Matter. He had a lot of extra free time as he was building what was then called Pervasive Health, before he changed his name to Apervita, and was helped us think through a lot of the mechanics of how we would build this place and how we would really accelerate the growth of startup companies. He's a really interesting background, not a healthcare guy by DNA, but very much a data and an analytics guy by DNA. And the problem that he's tackling and what makes his company so interesting is you hear a lot about interoperability of data and the challenges that we have with data interoperability across different EMRs and across different health systems. What Paul is really doing is building an interoperability solution for analytics. So you think about all of the interesting tools that health systems create to help them optimize care, optimize all of their processes, but they're all locked in one health system without the ability to really make them portable and have something that's an innovation developed by one health system ported over and used in another. And that's what Paul's platform does. It's a giant problem given the complexity of EMR systems, the complexity of hospital systems, and he is attacking it head on.
I agree.
You do my pitch anytime.
It's a really interesting story, and he's a really interesting guy, and very much appreciate you being here. Paul, Rishi, as always, it's great to see you and have you here for this event. So please give a little round of applause for Rishi and Paul, and let's take it away.
So first off, thank you all for braving the cold and coming here. We're excited you're here, and I'm really excited for tonight as well. You know, Paul and I have been meaning to do this, even without all of you, for a while, because we just met and we've been meaning to just meet for a little while,
Yep.
And so I'm really excited to now do it with all of you. So we'll all have a fun group conversation. And, you know, Paul is an entrepreneur's entrepreneur. You know, we were chatting a little bit before this, and, you know, he's built a half dozen, come hear about some of them, you know, before Appervita, some really neat stuff. Last company he did before this grew to 1,200 people, and he did some really interesting things in telecom, all throughout this thread of analytics. But he started early, you know, in people's lives. in our questions, the stuff you can't get on YouTube when you search for somebody and see their keynote. And so I discovered.
That was a good time when it didn't all end up on social media, right?
That's right.
It was a very good time.
That's right. Now you'll even have this.
Oh, no, it's on mic. It's on camera.
So, we got some fun stories from Paul. But, he started all the usual things you can imagine, but some unusual things as well. So Paul, I'm going to let you tell them, but tell us about the fireworks stand when you were 10 years old, and the software company you started in the 80s when you were 15 years old, and just, about your childhood, how you grew up, and how you knew you just had this early itch to start things and experiment, and this love for technology.
It probably came from a love of solving problems more than anything. So I've always loved sort of new ventures of one form or the other. But yes, my first business was running a fireworks stand at age 10, and it turns out that
very safe to do.
Yeah, it is.
Now you convince your parents to help you with it, right?
So there's no problem. There was 4 big American fireworks families: the Garuccis, the Santoris, and the Zambellis. There's probably a thread there, right? They're all Italian. And the Austins. And so the Austins were based where I lived at the time, Wichita, Kansas, and they were the 4th large American fireworks company. And so it turns out my best friend at the time, Morris Austin, was his dad was saving him the best fireworks stand spot in the city, which was right next to Boeing and Cessna, 2 big aircraft manufacturers. So people would pour out at 5 o'clock, and there'd be lots of people who want to buy fireworks. So it turns out his son wanted nothing to do with the business. Like I said, I'll do that. And then I had to go home and convince my parents to do it. And so they helped. So we ran a really great fireworks stand at age 10. So
any great stories from that?
I made a lot of money, actually. So this was in 1972, made $10,000.
Wow.
Which is a big deal for a 10-year-old.
That's a big deal even now.
My parents were pretty impressed, actually. So, it sort of gave me a taste. It was fun, right? You got to do everything. You set it up, and then you got to sell people. And as a kid, it was like pushing crack. It was, would you like some firecrackers? So, something I like.
That's a good quote today.
Yeah, and I sort of got infected by it. Turns out we didn't actually talk about this. One of my first jobs was working doing statistical analysis at 16, 17 for a gentleman who went on to become the president of the American Holistic Medical Association. His name was Dr. Hugh Reardon. He ran something called the Olive W. Garvey Center for the Improvement of Human Functioning. And I liked math, and so he needed some people to help him do some of the research they were doing. And so we had a thing, some of you will remember, TRS-80, old Radio Shack computer. Yeah. Yeah, you got it. So doing statistics in BASIC on a little Radio Shack computer, but helping him do some interesting stuff, working with a guy by the name of Sherry Sharaskin, who wrote a book called The Vitamin C Connection and a bunch of others. So that was my very first introduction to healthcare. And at the time, I thought a lot of it because he was into holistic medicine. He had 2 MDs, this particular individual, Dr. Reardon, but holistic medicine I thought was called quackery. Just as a kid, and turns out I got to see him touch a lot of people's lives, and so I wanted to do more of that, which is problem solving.
Right. Now you come here, you go to U of I, you study computer science, and you go out into AT&T, or what's now known as AT&T, and you end up having this great business career where you actually did a number of entrepreneurial things inside some bigger companies. Tell us about that. That's it gave you, I think, in your view, some really neat experiences from which you then started some of your own companies. Tell us about how that worked and in your journey through.
So there are lots of different types of entrepreneurs. I'm the jack of all trades kind of entrepreneur. So I like the sales piece, I like the marketing piece, and I found for some reason new business opportunities within large companies. So at Boeing and even at early days of AT&T Bell Laboratories, when I was doing research, then AT&T, then Lucent, and others. In those large companies, they provide great entrepreneurial opportunities, I find. So a lot of people say, can you be entrepreneurial in a large company? And the answer is absolutely. You've got to find the opportunities, but you can. The great news is you can make lots of mistakes, and so you don't usually get fired for making those mistakes. Maybe a few companies, but generally there's a lot of latitude, right? Because you're within a larger existing business range. So I had the advantage of, I ran sales, ran business development, ran marketing, ran development, pretty much every job except finance. And so for me, it was an absolutely great training ground to learn how to do all those things. And that's, in my experience, at least as an entrepreneur, served me really well because, and by the way, I did a lot of those things before I had a business degree. So all my background's technical, not business. Eventually went back for a business degree because I was trying to figure out all the things I was doing and why I wasn't doing them right, or at least not on an informed basis. And so, but I find it's a great ground to build businesses. So a number of the businesses I built have been entrepreneurial, but always starting with no staff, no money, just an idea, and the ability to go do something. And it turned out most of my experience has been on a global basis, markets around the world, and I just love that part of the process. And so I'd say I probably did that for 20 years. My 70s, as age 10 to sort of 30s, or even probably mid-30s before I called it entrepreneurship. I mean, I hadn't realized that that's where I was interested. But once you're sort of bitten with that creating something out of nothing, it sticks with you. And so that's the big companies gave me the taste of it, but then had the opportunity to do it outside, and I really enjoy that.
Now we're going to fast forward soon into Appervita and some of your tales from the trenches there, but tell us about some of the companies you started between the two. So you're out of college, you're in business school, you're doing the entrepreneurship thing, and you started a bunch of businesses, some really interesting ones. And I'd love for you to share what were the points of inspiration and how those went and what that was like before Appervita.
So I've let's see. If I look at my track record, very first company that I started sort of on my own as a software business started here in Chicago. Interestingly enough, we called it STEP. STEP stood for Software to Educate People, and it was before web browsers existed. So it's the idea that you could take lots of different types of content and repackage it for digital delivery, and it'd be a no-brainer in today's world and with web browsers, but it didn't exist then. And so the idea of doing that in a technical world where you wanted a reference manual and you wanted to use it. So the good news was we knew how to build the technology. So we raised a little bit of money, and what did good engineers do? We spent it all on building the product. And I said, damn, it's going to take twice or three times as much money as we just spent to actually do the marketing and sales piece. We'd forgotten about that. So we had a great product, but forgot totally about the marketing and sales spend. And so didn't get another round of financing for that one. And what was interesting is that only got to be 5 or 6 people. And what I figured out was starting a business with 5 or 6 people there's a lot of value in more founders in some ways, but it's also really hard. And I find young stages of company now probably the hardest. So it's when you've got 5 or 15, not when you've got 500. And so 500 I found it to be easier than 5 or 15 because there's a lot of stuff you've got to do, and there's the human side of it very much involved, invested as much as. So I learned probably more from that failure than I've learned from a lot of my other business experiences. So that one early taught me that you got to focus on what customers want, not what you want to build. You've got to focus on getting it sold almost before you build it, not before you build it. You've got to spend a lot of time. It turns out I found there's sort of 3 things. I didn't invent this. A guy, what was his name? He was George Wendt or Gary Wendt, anyway, from GE Capital, said you got to conceive, convince, and consummate as an entrepreneur. And so turns out lots of people conceive, and you can't build a business around it. You actually have to have all 3 skills. And so that first business experience taught me that I had to really get good at convincing people. So people who wanted to put in a little bit of money, and convincing the other 5 in the business to do things, and convincing potential of these prospect customers. We didn't get there, but prospect customers to buy it. And then you got to consummate, which means you got to really execute on all those on the development side. So those 3 skills I found are really hard to practice, and I don't know probably anybody that's good at all of them, and I'm not good at all of them. But I found I can't abdicate any of them if I don't do all of them. And the question is I could do a really good job consummating execution, but in my case, that young business experience taught me, boy, people who want to do it again and again and again are good people for me to work with, to partner with, because I like the convincing piece a whole lot. I do that reasonably well. I like the conceiving, but I'm not an original thinker. I'm not an original creator. I'm a knitter, so I integrate ideas. So I can put together other people's good ideas fairly effectively. So finding teams that work well with me and vice versa, that first experience taught me that there's magic, in fact, a lot of effort to try to put together the right team. And I find larger teams actually to start with are better than trying to do it on my own. And so that first experience is, I always go back to the problems that we ran into and didn't solve well. In fact, failed on miserably. So that was a fun first one. My last business before this one, for some reason, I guess I have a penchant for names that start with APER. So that company was called Apertio, and rather than Apervita. So it means open. Aperto means open. That company came about not because I created the idea. It was in fact, it was an existing product. It had come to the company I worked for through a series of acquisitions. It turned out to be orphan technology. It turned out to be orphan technology that absolutely changed the business model for how the industry worked at the time in this particular sector. So it moved all the value from hardware to software. It was in a growth industry, so they needed a lot of it. This was in the communication industry at the time. And so it turned out I didn't have to invent it. Now, what I figured out along the way is life prepares you in strange ways, and that's been my case. So I happen to do, my undergraduate's in math, and my graduate degree is in computer science, the technical side. And it turns out I did my undergraduate work in graph systems. I said, well, where are you ever going to get a job in graph systems? I mean, you just don't go find employment. This last company, my previous company, this one, the core technology that I was acquiring turned out to be a graph engine, in effect. And it turned out it solved a really unique problem. And just by strange coincidence, life had prepared me to understand how you create business value from that. So I was able to put the two together, and ultimately built that business quite successfully. And it's used in about 70% of the world's communication companies today.
Incredible. There were some really interesting examples of I think the same company, the Telecom company, and how it really changed telecom in probably all markets, but specifically some really unique markets where people are switching SIM cards.
So if I can, people have trouble today where we stand in healthcare, since we're sitting inside Matter, understanding the impact that analytics are going to have in the business of healthcare. And that's analytics that are applied to financial problems in healthcare, that are applied to operational problems in healthcare, clinical problems, strategic problems, supply chain problems. And the impact of data and analytics is going to be profound. Where we stand today, lots of organizations, providers, and others that serve providers don't quite understand that yet. So part of the reason for the analogy is, I'll give you a simple example of a kind of analytics and data that got built on the infrastructure that my last company built. So think about your mobile phone. The valuable asset for a communication company like Verizon is the consumer. And 10, 15 years ago as we started this, most communication companies understood nothing about their customers. They couldn't tell you who was cost sensitive and who was quality sensitive. But in places like South Africa, Indonesia, Philippines, most people carry a prepaid phone, and in fact they carry 3 or 4 SIM cards, the little card that you slide in the side of your phone once when you buy it. Well, they change it 3 or 4 times a day. And so it turns out that every time they change it, they're changing it because the person in South Africa, which may not be wealthy, probably isn't, is arbitraging the system. They're trying to figure out from 5 to 7 o'clock in the evening, this SIM card is cheaper than 7 to 9 o'clock, which is this cheaper, and then from 9 o'clock to 8 a.m. in the morning, this one's cheaper. And they literally just swap the SIMs because they're trying to get the best deal to minimize their expense. And so that's a very common practice. And there are some very high revenue generating quality sensitive customers. So what can data and analytics do about that problem? And so the kind of application that got built is, in real time, our infrastructure would find every person in South Africa. It would, within minutes, continuously figure out which were cost sensitive and which were quality sensitive. The cost sensitive customers, you could do things like, you could figure out that you're likely to swap your SIM at 2 o'clock, and you're going to need a 30% discount to be able to keep you on the network. So if I keep you on my network, because it's a big fixed cost business, right? Healthcare is a big fixed cost business. If I can keep you on my network, that's incremental revenue. and that's covering my fixed costs. Now, in your case, I may only have to offer you a 5% discount, but it's at 10 o'clock at night. So what we do with cost-sensitive customers is you'd text message the person, and you'd say, if you stay on our network for the next 2 hours, we'll give you 20% discount on all your calls, which means maybe I won't put that next other SIM card in my phone. And so that would generate literally hundreds of millions of dollars for telecom companies just by keeping people on their network. So that was pretty darn effective. Now, what can you do about quality-sensitive customers? Because they're a different type, right? They don't care about getting the cheapest price for the next 10 minutes. Well, it turns out that your mobile phone doesn't decide how much power to output. Okay? The network tells it how much power to output. So what can you do with quality-sensitive customers? You can turn up the power in their handset. That means they're more likely to be connected, have a better data connection. The other thing you can do is that the phone has a list inside of it of the cells that the phone can roam onto. So you see those big cell towers? So for cost-sensitive customers, you can make the list very short, like 3 entries, which means that it may be able to see 12 different cell towers it can move onto, but you only give it a list of 3, which means the person's probably more likely to get disconnected, right? So the call's going to drop. But the quality-sensitive customers, you make the list 12, and then therefore they have lots of roaming options. So their call's likely to be connected. So their customer experience from a quality perspective. Now, all of this is going on all the time for all the customers in the country on a continuous basis. So you're running predictive analytics to figure out who's likely to churn, who's cost-sensitive and who's quality-sensitive, who's likely to churn, when they're likely to churn, how much you need to offer them from a discount. Those are all predictive analytics that are running dynamically. And then you're doing things like delivering messages to people. The other thing you could do, and where we finally took it, is it used to take communication companies about 3 years to replan their network. So that antenna that's at the top of the network, they used to fix them. So they'd have to figure out that this area is going to be covered with this signal quality, and then it's going to intersect another cell and another cell. That was a very laborious process. All those cell towers now, all the antennas tilt and pan, so they can move, okay? And so now the software dynamically replans the network on a continuous basis. So if you watched very carefully, many of those cell towers are now, the antennas will move during the times of day. And in some countries like South Africa, they'll move to where the quality-sensitive customers are. And so they'll refocus the beam of the antenna, or they'll tilt the antenna slightly to deliver better quality service. But that's happening completely automated. There's no people involved in any of that process. And you can do the same thing, by the way, with customer care. You can do the same thing with marketing. You can do the same thing with operations. All of that value that gets created in a mobile network that used to take lots of people years to do, not being able to figure out who your customers are, that's all done on an automated basis now. And so our platform provided for that kind of infrastructure. That's all coming to healthcare, okay? And we're at the beginning of the process. That was a 15-year process, and it's probably got another 10 to go to continue to optimize. In healthcare, we're in the first 5 years of that, okay? So we've got another 25 years, in my opinion, of that kind of dramatic impact where data and analytics are going to drive lots of automation, and automation we haven't even thought of yet.
So now say you're in the last year of this last company. What's the lead up to deciding to sell it? Tell us about that. What were you doing? We've got some entrepreneurs in the room, some bigger companies.
Trying not to sell it.
Trying not to sell it. Tell us about that. Get out, and then we'll talk about where you were when you kind of had the inspiration strike for this.
So the last year was the beginning of 2007. So we all know where the recession kind of came, right? The Great Recession. So we were making great progress. We had an offer for the company almost every quarter for people showing up going, would really like to consider acquiring your company. That we got within $10 or $20 million of saying that's the right offer. And then their offer started going backwards, and we couldn't figure out why. Well, it turns out they were in a merger process with another company. But we just didn't know that until it became public. So they were trying to back out of the deal at the end of the day. Turns out we almost got the deal. A year later, in 2007, they showed up, their chief competitor showed up and made us not a great offer, and we simply told the other party that we had an offer for the company, and they doubled their offer that they made a year previous. And that was in part because it turns out I find people buy not for just gain, they buy for pain. And so the reason that we sold the company to Nokia Siemens, and the pain was they had integrated all of their products onto our technology, and it would have cost them $100 million to undo that in about 3 years. And so they had a lot of pain, and if their chief competitor bought it, they were screwed. And so, so they paid the price because of they were going to get screwed. And there's great upside. We took that business from $50 million in 3 years to $500 million of revenue within their structure. So it was a great success for them. But it was the pain that got them to buy. And so we weren't trying to sell the company. We just, so entrepreneurship is, in my experience, is about an economic return. Otherwise, you call it a hobby. And so the big job I find is, and I ask people, true or false, a comment, true or false, you're the best judge of value of your business. It's true. And that, if you're an entrepreneur, it's the one thing you can't abdicate, in my experience. And boy, it's hard. Your investors will have an opinion, your spouse is going to have an opinion, everybody's going to have an opinion about what it's worth, right? You can go get investment bankers, and they're going to have an opinion. Acquirers are going to have an opinion. But as an entrepreneur, you can't abdicate that. You have to figure it out. So in this last year, what we were trying to figure out, and it was hard, and but if you don't own the problem, you can't maximize value. So we were trying to figure out whether or not we wanted to take the company public, because we had packaged it to take it public in the fall of 2007. By the fall of 2007, the market was getting bad already, right? You could see something coming. We had no idea it was going to be as bad as it was. But we said, okay, public, we could do it, but we don't know what's going to happen to the stock price. We got a great cash offer for the business, and we can continue to go it alone. And the choice ultimately was the risk of, we knew the next selling window without the bottom dropping out of the market was going to be probably for the next set of buyers 3 years away. So it was about an economic return, which is could we increase, and for our shareholders, their relative return over the course of an IRR difference of another 3 years and probably another 40 million capital in and because we'd raised 40, probably going to have to raise another 40. And it was a pretty clear decision. And if we had hindsight, which means we knew how bad the market was going to be, we would have sold it at a drop of a hat for the amount of money we were being offered. It turned out we made a really good fortuitous decision. Turns out on December 17th of 2007, Nokia Siemens had a board meeting to buy the company, and this was the first acquisition of any size they did after they merged, and the board didn't approve it. And we said, oh, damn. They decided to hold it over for a second discussion the day after Christmas. And for the Germans and the Finnish, a board meeting the day after Christmas wasn't something they wanted to do. They did it, and they agreed to acquire the company. That deal would have never gotten approved at the January board meeting. So I think big deals, first of all, exits for companies are like unicorns. You may get a lot of interest, and those are sort of the mirage unicorns, but really getting a deal away is extremely hard in my experience. And so we found the right buyer at the right time. We took the right business decision, somewhat fortuitously, without perfect knowledge, but it was making that decision. So at the end of the day, the board looked at me and the investors said, do you want to sell or do you not want to sell? And I said, you weigh that up, it's the right offer at the right time. And we fortunately, with good fortune, made the right decision. But that last year was a pain because we're trying to run the company and go through a sale process, and that's very hard to do in parallel.
What a story. Okay, so now we fast forward a year or two. You're maybe in the, I don't know if uncomfortable, but in the unusual position of being in between companies. You're not doing something. And you had the story about you were at Mayo when this kind of, the idea struck you. So tell us about that.
Curious, lots of entrepreneurs in the room, how ideas find you. I find half the ideas find me, and I find half the ideas. So some people claim that I've worked with in the past that they create all their own ideas, and I'm just not that type of person. Some say all the ideas find them, and I'm also not that type of person. So I was kicking around, got asked by the trustees and executive team at Mayo Clinic to help them think about their digital future. And I did not want to go to the meeting. My father said, you got to go. The trustees are going to be in the room, and they want some of your experience. I said, I don't want to go. I don't have any interest in healthcare. And he twisted my arm hard enough. It was on a cold winter day. I went. And I sat through the first meeting and go, oh, my God, are these people behind? And they knew where they wanted to go. They had the vision for a digital future, but they had no idea what technology was going to do. And this is one of the premier institutions in the world, right, Mayo Clinic. So tremendously smart people. But they hadn't had the good fortune of being in finance, which I've been around, being in comm and being in CAD tech and IT. And so just because of those different industry experiences, you kind of say, well, boy, those problems have been solved, those problems. Now, there's a lot of differences, as we all know, in healthcare. And so uh, sat through the meeting, and they said, would you help us? And I said, well, let me be precise. They asked me to write them a corporate development check because I sold my last company. They said, would you donate? And Mayo's been very good to my family over many years. And I said, no, I'll give you money later in life, perhaps, if circumstance permits. I love you guys, but I'll give you some of my time. And so I spent almost 2 years on my own time. It wasn't full time, but helping them think about their digital future. And the problem we kept coming across is the one that it just sort of stared me in the face, which is what we built Apervita around, which is they kept saying, we create all this great stuff, and they called it intellectual property, IPR stuff, literally, but we can't get it to market. And I said, what do you mean by IPR, intellectual? Well, it turns out about half of what Mayo Clinic produces now is an algorithm. So literally, of all of their disclosures of intellectual property production, it's not a device, it's not a drug, it's an algorithm. And they call them lots of different things, but they're just algorithms. And so I said, wow, half of your intellectual property production, thousands of disclosures a year. And so sitting in that room, the problem they kept saying is, well, we can't get this stuff to market, but we know it works here at Mayo Clinic. How do we share it with others? And so with their dispensations, I got to spend time with the National Health Services, Spain, Italy, and the UK, with the with Cleveland Clinic, Johns Hopkins, a bunch of others. Turns out everybody's got the same problem. And they all know that these algorithms and these data that's coming, we're just on the precipice of unlocking it, is going to be valuable. And every institution we talked to said, we got the same problem. I said, well, boy, if everybody's got the same problem, can you build a business? And then you start, the first 2 years was going, well, why is this problem different? It turns out there are millions of algorithms from thousands of organizations. That doesn't sound like a problem one company can own. I couldn't go out and acquire all that stuff and do deals to acquire all of the Mayo Clinic. They're just not going to do it. So the only way to do it was a marketplace. And so that gave birth to a different business model. So most of the first 2 years was not technology. It was trying to figure out how you unlock the business value if you could create a business model that would work. And so we spent 2 years trying to figure that out, and then another year trying to raise a little money around it, as most people here do, and the friends and family, and then another couple of years trying to build some initial technology.
And break that down. When the first, talk about the trenches. So when you first, when did you first realize this was a business that could interest you? And who was the we? Did you have co-founders? Did you have early? Tell us about the first 5 people in.
So it took me about a year and a half to figure out that there's a business opportunity, because I find customers who are trying.
And were you working with Mayo during this time?
I wasn't working with Mayo, but spending time with other institutions, and so talking to prospect customers.
Sure.
At the end of the day. So somebody else, I was paying my own way at the time, but it was essentially somebody else sponsoring me to go do the market research to build the company. So after a couple of dozen conversations, it was pretty clear that there was a need. And then it took dozens and dozens of more conversations and lots of hours to figure out that there was a business problem, just not a need. And so I did that early on. I had a gentleman who was a co-founder, who was a co-founder at my last company, so I knew him. He thinks he's a business model guy. And so I asked him to help me think about it. And so he said, okay, can I be sort of a co-founder? And our relationship tends to be, he tends to help me found, and then he tends to be operational for the first year or so, and then he retires, which is great. So, as the company grows more professional, he doesn't want to do the operations piece. And so we've repeated that cycle now 3 or 4 times in various companies. And so
did you stay retired till the next one?
He tinkers with all sorts of businesses. He's now writing children's books on Kindle. He's a mathematician.
Wow.
Anyway, but he has fun doing that stage. But he's the business model guy.
Yeah.
Okay? So, and I find I need people to work with. I don't do startups well on my own, and so I spend a lot of time finding those sort of folks. So, for me, the challenge was finding a technology person. And so actually I built a relationship, spent 2 years on it during those first sort of 3 years roughly of business. And I wanted to acquire the company and the technology, and they ultimately we couldn't strike a deal. And so that was almost like restarting the business idea from scratch, because it's like, now I don't have a technology team. And so I luckily along the way met somebody else who became my sort of technology CTO. And about 2 years in, we decided that we weren't going to be able to use the other company's technology, unhappily, and we sort of started to hedge and building sort of the other half of it. And luckily that got us through. But I had spent at that point about $1 million of friends and family money, and I had to go back and say, we don't have a technology platform. What I thought we could do, it wasn't going to happen. And so that was the first near-death experience of many. I'm still having them. And so for those entrepreneurs, you guys will all know this. If you don't have a lot of near-death experiences, you're not a startup, you're not an entrepreneur, and you got to survive all those. I mean, it's about surviving, not thriving most days in my experience. And so we got a technology platform built, at least a sort of. So
this is 2010, 11, 12?
It was 2012 into, then in 2013 we ended up raising, and it was piecemeal, but we raised another $3 million in seed capital. And for those entrepreneurs here, Chicago's been fantastic to me. We got a great community. So we raised a lot of money from the prop trading firms here in town, so the high-frequency traders. So folks like DRW and Alston Trading, they got the idea that technology and analytics were going to change the healthcare, and they were willing. Luckily, they're generating a lot of capital. So we got capital from some unique places to sort of further the idea.
Any tips to? We're going to ask this at the end as well, but any tips to entrepreneurs who are raising money at that seed stage?
Friends and family in seed stage, bloody hard is the answer. And they say every round is hard. You got a lot of personal investment in friends and family. One is your network's probably, my experience is your network's way bigger than you may think it is as a friends and family stage. The question is whether or not you're willing to ask for it. And so ask your friends and your family, and unless you ask, you don't know. I found money under all sorts of rocks of people. So my sister happens to be friends with the heiress for Cessna, and she happened to be sort of an extended friend. I would have never asked her. My sister says, oh yeah, I'll go ask her for money. And she showed up with a $25,000 check. It's like, cool, know any more, sis? And she came back with another half a dozen. People who are willing, and literally her, let's see.
People might ask you for an introduction to her after that.
So my point is, your network's way bigger than you think it is, but you also have to be willing to ask for the money, and I find that hard. Particularly somebody I don't know.
How do you reach out to people? So say somebody thinks, oh, I kind of can think of somebody who could find this interesting. How do you reach out?
Personal introduction. If you can find somebody to introduce them, that's the magic. So in Chicago, it turns out my father introduced me to Larry Levy. Larry's invested in a lot of companies and a lot of the funds here in Chicago.
In the room.
Yeah. Great investor. Fantastic investor. I'll tell you a story about Larry.
Okay, there we go. Hey.
Okay, I'll tell you a story about Larry, and then we'll come back to it mainly. So I went to pitch Larry at lunch, and lunch was his restaurant, right? Or the Spiaggi here in town. And so I said, Larry, you probably don't know, there's this analogy for what we do is this company called Splunk, and they did 4,000 customers at 3,000 customers at 40,000 a year. No, it was 5,000 customers, 40,000 a year. $200 million in revenue. They built it, over the course of 10 years. Then they went public. They got a $3 billion. And so I said, Larry, you probably don't know the company and what it's about, and so I'm not sure the analogy worked for you. Sorry about that. And he just started smiling at lunch, and I was going, oh no, I blew this. He sort of indulged me a little bit more. He said, oh, by the way, that Splunk thing, I made a lot of money when they went IPO. So it turns out he resonated with our idea, and he ultimately invested. So sometimes luck has it. But Larry invested in, as I understand it, Nest and a whole bunch of other interesting. The point is, I had to ask him for the money, and that was hard, and I had to try to find a pitch. So your network's bigger than you think it is. Follow every one of the bloody leads, particularly at a friends and family stage. So you'll raise more money out of that network, and even people that are 1 or 2 steps away from you. So it doesn't have to come from your immediate family or your cousins. It'll come from friends of. So I raised $75,000 from a number of Northwestern physicians. I didn't know them. My sister, again, knew them, and they said, that's a really cool idea. Yeah, we'll put in. And I thought they were going to put in 5,000. They put in 75,000. Said, wow, where can I find a few more of these? So, but yeah, I tried to, at the friends and family round, I had to turn over a lot of stones. So
now, when you're describing the business to people who may not be technical, you know, how, because your idea is a little, it's not maybe technical, but it's complex maybe at first. How would you describe it? What advice do you have about how to describe it to somebody who's not from the industry?
Because Brad and I work together, or working through this now. I think our customers would say, God, we get it, and we've gotten pretty good within 5 minutes. Simplifying is the hardest thing to do, I find. Distilling a value proposition. Literally, I start with sort of 3 chapters, and then it goes to 3 pages, and then it goes to 3 paragraphs, and I think I'm making progress, and people still don't understand it. When you get it down to 3 words in terms of what the value you deliver is, you know you got it. And if you can make those stick, so my last company, every single customer bought for the same 3 reasons: simplify, unify, innovate. I had an incredibly compelling proposition for what it meant for simplification for them, incredibly powerful for what it meant for unification, incredibly powerful on innovation. Every single customer over the entire life of that company bought for all 3 reasons. Some valued innovation more than simplification. Some valued simplification more than innovation. But they all bought for the same 3. That is the hardest thing to do. If I ask my board right now, they'd tell you my proposition's way too complex, they don't understand it, and we're not good at putting it across. And that's just the truth. And so Brad and I are trying to, how do we get it down to something really simple? So if I describe my current business to somebody outside, say, do you know what Kindle is? Kindle allows you to write a book and publish it and deliver it to lots of places. That's what we do by analogy for analytics. Not a bad analogy. For those that are in the finance market, we use Bloomberg as an analogy. So finding a good analogy, which is Bloomberg's a neutral Switzerland-like marketplace where counterparties can come together. You pay a subscription. You can acquire data. You can acquire analytics. You put them together. You can make money by trading. That's what Bloomberg does. That's what we do for analytics. And so
tell us about what the business model guy came up with. So, what is the business model, and what were the first couple customers, and tell us the stories of getting those live.
So the business model was for me the major innovation, and it's still candidly with Appervita is to be proven. Okay, so we're not there yet completely proving it. We got a lot of good evidence that would support it's the right answer, and if you think about it logically, it's the only right answer, but doesn't mean that the market's going to accept it yet. Okay, versus all other alternatives. So the business model innovation was a marketplace. So when Jeff, who was this gentleman who was my sort of business model partner on it, he said, well, if there's millions of things on the supply side and there's millions of problems to solve on the demand side, no one company's going to own that. And the only way to solve that problem is a marketplace. And so think about what eBay's done in terms of people selling stuff with people buying stuff. What Amazon has done with shop owners, right? Millions of shop owners selling stuff across the thing called Amazon. You're buying from a shop, but Amazon's the conduit. So the only way to get millions to meet millions is a marketplace. And so that was really the first business model innovation. Then the question is how you make money at that. So, okay, do you charge for the platform access to Amazon, and then
polling volume of data?
Turns out Amazon's done a good job, right? For those of you and like me who finally became a Prime customer, I'm a late adopter, but I pay the $100 a year for Prime. So you charge for the platform, and you charge for the content, and you take a share of the content. That business model is very unique, and the primary, I guess, innovation is not only the marketplace concept, but the fact that it's a neutral marketplace, because we don't own the analytics that Mayo Clinic brings. We don't own the analytics that GE brings. We don't own the analytics, the data that WebMD brings to our platform. We don't even license it. Okay? They own it. They license it like Kindle, like the book, across our platform to another party who subscribes to it. And so that idea, that was a big risk. First of all, was there demand? And we're still proving that. We're not there yet. And second is, would organizations agree to have their analytics that touch people's lives licensed through a common legal mechanism? Because if Mayo Clinic, or let's say Johns Hopkins, is licensing analytics that could make an incorrect determination and kill somebody or miss somebody, would John Hopkins actually licensed that across a third party's legal agreement. And we now have sign-off of pretty much every major academic institution in the United States, and most major companies like GE. They're happy with our legal terms. Now, the way we did that is we said, if your attorney can improve the legal agreement, then have at it, and we would incorporate the changes. And so literally incrementally, we just keep improving the legal agreement based on everybody else paying for it. So, GE's attorneys paid us a lot of money, in effect, to improve the legal agreement, and we're happy with that. So we've gotten to a point, but those were big risk bets when Jeff and I were talking about business model, because you'd have to provide the commercial infrastructure, the legal infrastructure, and the technical.
Now, give us an example of the demand side and the supply side. So what's an example of a user paying for it and benefiting from it and using it, and then somebody who's supplying it and what they're getting?
So here at Matter, there's a number of you will have met Quant HC, a hospitalist by the name of Donna Edelson, Dr. Edelson. She's a hospitalist at University of Chicago. She's built a suite of analytics that help determine in an inpatient setting if somebody's going to perish, die, in the next 48 hours. And she's got it down to 90-some% accurate. Okay, so she can predict before clinical physician certainly any normal clinician can see those signals. Okay, so very good at predicting death. And therefore, you've got a lot of time to intervene if you've got 48 hours. So she's a Matter member, and she's building a small company. She built the technology at University of Chicago, took it out. So she's an example of supply side.
She's supplying the data.
She's supplying the analytic.
The analytics.
The suite of analytics.
Yep.
Okay. So in her case, her only other business alternative was to go build a company and build a technology stack, and that would have cost millions of dollars. That's not her expertise. She is an expert in the math and the algorithm. And so she's built analytics on our platform, that suite of analytics, and is selling it to hospital systems. Okay?
And what's involved in building it on your platform?
So if you can...
It's hosted on the platform?
It's hosted in the cloud, okay? Yep. It's all in the cloud. So if you can write a book on Kindle, or you can build an analytic, an algorithm in Excel, you can probably build an analytic on our platform, okay? So we've got simple tools and very sophisticated tools, but they're just authoring tools, okay? And then there's publishing tools, so you can publish it to the marketplace. But that's what Donna's team does. She's got people who know how to build that kind of stuff.
And usually, are these suppliers exclusively on your platform?
Nope.
No. So
we're an open market.
Yeah.
So, and that's by design, because we don't want to lock them up, and generally they don't want to be locked. So GE's another publisher, or author and publisher, so they publish revenue cycle analytics on our platform. So same as Donna, just a bigger scale. So for Donna's algorithms, customers are the Appervita system here in Chicago. So they subscribe to those analytics, and then they send our platform real-time data from all of their patients. And real-time means, in their case, every 15 minutes. And our platform takes Donna's algorithm and their data, makes the two meet, runs all the computations, and routes all the feedback to their clinical staff providing service on the floor.
And usually, is it integrated into their systems, or how do you
So it can
output?
be. So all the analytics and data you bring, you get a set of APIs for, so that you can use those analytics in another system. So you can, it'll run in Allscripts, it'll run in Epic, it'll run in Tableau, it'll run in Excel. But you can use the same analytics and data from a cloud-based server where you don't have to have the computation power to run those analytics and display them. So your finance folks can open Excel, and just like you use a function, in effect, like a little function in Excel, you can use our platform to access the data and the computation. So the Appervita system is deploying those sets of analytics. Now, since they've already got their data hooked up to us, they can now buy a second analytic, and a third analytic, and a fourth analytic. And so their ability to acquire new analytics and turn them up is really determined by how fast they can innovate and how fast they can adapt workflow. So it's not...
Buy through the Appervita?
They buy through the Appervita platform and marketplace.
Yeah.
So
doing their agreements with you?
they're doing all the agreements with us. So, and all those agreements are...
And you're writing a check to the supplier of
That
the
is correct.
application?
We write it, so Appervita sends us a check, and we send a check to Donna, so, which she loves.
Keeping some in the middle?
Oh, we keep a little bit in the middle, of course, but we wouldn't be a business if we weren't. So,
That's right.
So we get the platform revenue, so more transactions that ultimately that Appervita will do, more they'll be charged for the platform, and we keep 100% of that revenue. And more content they consume from more places they roll it out, more Donna will get, and a bigger share we'll get of that.
Now, marketplaces can be great businesses, but they're famously difficult to build.
Very.
Right? Because what comes first, the chicken or the egg, the
Yep.
supply or the demand? What came first in your story, and how did you get one, before the other?
So we have not mastered that yet, okay? What we found is we didn't have a chicken and egg problem, so that we kind of decoupled it early. And the reason we didn't is it turns out the platform's pretty useful on its own. And so if you write your own analytic and bring your own data, you can do stuff. So you don't have to actually have a supply-side equation. You can build your own and sort of DIY it. And that's gotten us over sort of an initial hump. The marketplace, we're beginning to see in most of the deals we do, content across the marketplace. And increasingly, it's really what...
Instead of just the demand side using the platform for their own.
Exactly. So, what Brad has been trying to pioneer is, what we're trying to do is more deals with people who get us to more customers. And so we've just been successful with a major hospital association, and that hospital association has 1,400 hospitals, and they want to build analytics, and they don't have a delivery mechanism. They have all the data, as it turns out, for all 1,400 hospitals, but they don't have a platform. So they're a perfect kind of scale partner, because now they have a reason to use the platform. They have a reason to publish so others can subscribe. They make money that way, or can. And they carry that other people's content, including their own, to a large number of hospitals. We couldn't sell hospitals or a couple 100,000 practices on our own. The business isn't scalable. There's no way we could have enough shoe leather salespeople. So it's those partners that are really fundamental to scale. And candidly, the publishers, a lot of the people who bring content, like GE, they've got their own customer base.
Love the shoe leather salespeople.
Yeah, sure. You pay them way too much, don't you?
Well, I just meant I love the analogy. I love the term. So
Needed.
That's right. But give us a sense of how how big the company is right now, how you think about its stage in the life cycle of a business, and also, what are your top challenges? What's keeping you up at night? What are you excited to do when you wake up?
Top challenges and what keeps most of my team up is how to accelerate the provider sales cycle. It's a disaster.
You had a good term for this, right? The fat middle or whatever it was?
Oh, it's thick, and yeah, it's very hard to get through. I spent some time earlier, just a head meeting at another Matter company or two, and everybody's, all of us who serve, certainly providers, not to mention payers probably, have that problem. And so there isn't the same business driver. So my last industry, we won because we ended up, there were usually 15 people tendering. There's an RFP that were tendering for a piece of business. We ended up as 4 out of 5 on every short list around the world. And the way we did that is not because we could get to every one of those deals, but because Motorola carried our product, Siemens carried our product, IBM carried our product, HP carried our product. So we became the de facto. Providers are real hard because they don't have an RFP process for most things. And so you never end up in a position where you can control a purchasing cycle. And so it's a pretty sort of opaque buying process. And so you have to do stakeholder management in a very different way. And so that thick middle is what keeps me up every night is, how do you shorten the sales cycle? How do you...
on the demand side, you'd say.
On the demand side. The supply side in my business is a piece of cake. There's so much content. Everybody needs to get it to market. Donna doesn't want to spend $5 million of her money or an investor's money trying to build a company. She can get it to market with almost zero capital. So supply side's really compelling. The demand side is like anything. It takes adoption. And so it's getting that selling cycle. So for us, the partners, like the type hospital association we talked about before, is absolutely key because they have access. So if you're going to try to solve 10,000 problems, you got to get across it with lots of different partners, and that's what we're trying to do.
Right. Okay. Well, great. Thank you so much for sharing. I want you've got just wisdom from so many startups.
Stars.
Well, that's where I was going. Right? I said, what question do you most want me to ask? And I loved your answer. It was one of the greatest answers. It was ask me about my scars. I know all of us have some scars. Anybody who's tried anything innovative, certainly entrepreneurial. So tell us about some of those scars, what you learned, how you got through them.
All the companies I nearly wrecked, or all the times I nearly wrecked a company. Oh boy, okay, so it's a long list. I'll give you a couple. I've got a lot of scars. Just on a side note, I mentioned my sister before. She's good at raising money, so it turns out she's actually good at building companies too. She's my baby sister, so she's the amateur entrepreneur in the family. I'm the professional. Anybody know what the difference is? I got way more scars than she does, and which means she's probably better at it than I am. But got a whole lot of those scars. True or false? Investors want to see the value of your company grow.
I got this one wrong, by the way.
False. Absolutely false. And here's why. There's an important subtlety, and I nearly have wrecked 2 companies on this, and I know the sort of rule that I should operate by, but it's been hard to keep in my head. So the investors want to see the value of their investment grow. And the value of the company and the value of their investment are 2 different things. Every time you need to raise money, your interests depart, okay? And so they want to see the value of the investment grow, and therefore they want you to think about selling. Because why do they want you to sell? Because they're measured by IRR, right? And IRR has time, internal rate of return. It has time attached to it. You want to build a company. And by the way, the reason I nearly wrecked a company is investors will tend to stop to make you consider selling. And so my last company, we took it off rails literally early in its life when we were blowing away our sales targets, okay? We were doing extremely well. And I went back and said, guys, I've got more growth opportunity. Would you like me to handle it? The answer was, yeah, okay, cool. And I said, well, I need some more money because I got to put more working capital in. And they said, ooh, let's think about that a while. Why don't we think about selling the company? So we spent 6 months at an early stage doing the dog and pony show, and I lost 6 months of sales. And it nearly came to the point where they go, oh, the business isn't performing that well. Well, so I'm spending all my time trying to sell the company. And I was, relatively naive. We thought we had a good company and proposition because the technology development, as it turned out for that company, was my last company, had already been done. And so we had a very quite saleable asset. But it was the wrong thing to do, and we all knew it. But my interests were very different, because my return was in equity and theirs was in cash, and they wanted to see us consider something different. And that's a mistake, even in my current company, when you have interest in the company, that you kind of get stuck into. And the question is how to get investors off of that. And so I can't say I'm good at that yet, because you got to stop investors at some other process and say, it's not the right thing to do. We're either not saleable, it's not the right time, even if there is interest. And so
how do you determine
that's a hard one.
It's the right time?
How do I determine it's the right time? It's really a formula of very simply risk return, which is where does the economic return come? Okay, some people value that as a long-term return. Let's take it public. That doesn't mean you can unlock that capital very easily. So it's not a great economic return for an entrepreneur, at least early on in the process. There may be paper net worth, but so you got to figure out where the exit opportunities are and what they're, who the set of buyers are likely to be and how attractive you'll be now. So people ask me what the job of a CEO is or an entrepreneur through a young company's life. And for me, it's only 2 things. Well, there's a vision creation piece, but it's figuring out what the outcome is going to be. And that means, that's where I said you can't abdicate that. You got to figure out what the likely outcome. So it's figuring out how many companies are likely going to be buyers, when, and therefore, does that risk basket of return, how does it marry to the downside, which is, well, the technology base is changing underneath you, customers may be choosing a new generation of solution, your competitors now trying to actually compete with you. That's a hard basket, but there is a way to begin to put it as an assessment and then take some advice. So I said you can't abdicate it. I didn't mean by that don't take advice. Inform your decision with a whole lot of people, right? Good advisors, investment bankers, spouses, board members, advisors, and then weigh those 2 risk-return equation and ultimately make a decision. I will tell you that there's lots of distractions around, should we build the company for a particular exit? Should we build the company for, that's all bullshit. Build a valuable company and there will be a return. So the best option you always have, and for me is, and this is hard as well, because you can't always get there, is if you have a path to self-sufficiency, then you always are in control. If you don't have a path to self-sufficiency, meaning some profitability that lets you operate, then you don't. Then you're always looking for money, and so you've got to find a way to at least survive. Maybe not thrive yet, but if you've got a downside plan, a lot of people say you got to plan for success. And I said that for me, it's not true. You got to plan for failure. When you know what the downside is, then you know you've got a lot of opportunities to take risk. And so the risk taking means putting the company in a position when it is, when you create value.
Yeah. That, by the way, I just think that's a very wise thing, right? I mean, you jump from a floor, not from a ceiling, right? So you really need to establish a floor to jump from, but it's counterintuitive to a lot of people. So I think that's a really wise thing.
The best piece of advice I ever got, though, on when to sell is it's not point of maximum value, the point of maximum hope. That's the hope for the acquirer. Okay, so if you can create and there's local maximum and there's global maximum if you're a mathematician, and so you never know if you're at a local or a global. All right, you've maxed your hope out, but there's points and people. It's measuring the as I said earlier, pain people will often pay you more for than gain. So know how to create pain for your potential acquirer. So Brad tells me he used to be with IMS and did corporate development at a big data company, analytics technology company. He said IMS is a buyer. Correct me if I'm wrong, Brad. IMS is a buyer that buys when they feel pain. They upside they could care less about. They're doing well enough. But if they think something's threatening, they'll go acquire it. And so threatening is good. And it doesn't have to be negative threatening in the sense you're necessarily competing head-to-head, but it has to create a problem for them. And so people pay to solve that. So that, for me, when I'm trying to figure out the equation, if I've created enough pain for enough people, there's a good business opportunity to exit.
Good idea. So we got a couple more questions, and we're going to jump into Q&A. We have social Q&A for tonight. So please feel free to add your questions, upload questions you like. We're gonna jump to those soon, and I think you see information here for just matter.socialqa.com. Paul, you get to see a lot in healthcare. If you're a Matter entrepreneur or you're somebody who's not here yet, but you're interested in healthcare, you're interested in starting something, joining something, what themes, what topics, what areas in healthcare really interest you? If you weren't doing something, what would you jump into maybe? And two, how should people more broadly assess, whether or not there's a business opportunity there?
Ooh, good questions. First of all, I think we're at the beginning of the transformation in healthcare, so I think there's a ton of opportunities. There's also, therefore, going to be a lot of noise. There's going to be a lot of other entrepreneurs that are trying. Ultimately, there's a lot. If I look just sort of over the horizon, it's largely about automation. So how can you take a lot of the work product that we're doing today with humans out of the process? And so it's figuring out how to automate a lot of the infrastructure that we take for granted on a human basis. So in very broad areas, it's that. There's no question that we're going to get more involved as consumers. So the whole consumer engagement thing is going to be a rich space, as a lot of people know today. We think, obviously, analytics and data are going to be enormous. Drive a lot of the structural transformation in healthcare. How you sort of look at a business opportunity. So for me, I boiled it down to kind of three things. I put sort of every business opportunity that I look at, it's technology, team, and timing. And the technology piece, it could be a service idea. It doesn't have to be a piece of tech as such. But it turns out that technology, in my experience, you can prove if it works or doesn't. It's scientific. So you can say, does this thing do the job or not? Technology is actually pretty easy. A lot of people, as I look at business opportunities, they say, well, we got 2 out of 3, technology, team, and timing. We can make it a go. 2 out of 3 is fine. Turns out every business I've ever met that has 2 out of 3 fails. You have to have all 3. And so I don't let a business opportunity that go past me unless it has all 3. It meets all 3 criteria. It has technology, it has or service concept, it has the team, and it has the technology. A lot of investors you'll meet say, we bet on the team. We don't care what the technology is. We don't care. That's just bullshit in my experience. You can't. Good teams do good things, but if they don't have a technology and they don't have market timing, they're going to fail. So you have to have all 3. Turns out that teams are not science, and they're a craft. So we have science and we have a craft. Crafts are different, which means there's no right answer. You have to kind of put the puzzle pieces down. You have to have some experience to get a team to work together. You have to figure out how they fit. Turns out timing is the hardest one, and it's an art. So, meaning you can create a team, you build a team, you can create technology, you can't create market timing. It exists or doesn't. The only way to figure out market timing, therefore, in my case, when I look at business opportunity, I spend all the time on timing. Knowing that I can probably build a team and build the technology. It's figuring out when and why and how fast customers are going to buy. And that's where my current business, the demand side, is the hard one. I should be able to know the answer to be able to predict it. We're still learning. And so I can't tell you whether or not it's today or 6 months from now perfectly in terms of where the inflections are. That's my job to know. Okay? So the timing is an art, and it's a place you got to spend the most time because you can't create it. Customers who are dealing with the problem have got to solve it.
So we're gonna, by the way, link two of the top questions here.
Okay.
So one of the questions, it's a technical question, a good one. How do you get the data out of the health records for the analysis? How, that seems challenging for a number of companies. What have you found around that? And then two, how do you differentiate noise and garbage in all this data? How do you think about that topic?
So how do you get data out? So I would have told you 3 years ago that it was going to be hard in terms of getting the data out, and it was hard. So if we can use a certain unnamed Madison area company, with a CEO with a first name we would probably all know, amazing in an industry that's $3 trillion, everybody knows a CEO by her first name. I would have told you that 3 years ago it was a legal problem, meaning that they contractually prevented you from getting the data out. Their contracts had gag clauses in them, which I've seen and signed. They made it virtually impossible. Then the technology didn't really work, so you couldn't get it out technologically. And now we've kind of matured to they're making a pain in the ass commercially. So it's no longer a technical problem to get the data, genuinely. Doesn't mean it's easy.
What's changed?
The technology's progressed, and the standards have progressed. And therefore, whenever standards and technology kind of come together, it's a great time to start a business. So it's easy, relatively speaking, easy enough to get the data out. Okay, it's not perfect by any means, but we're at truly or past the inflection point. They're making it a pain in the ass commercially now. So, we have to approve you, So there's still hurdles, but getting the data generally is not, the thing we're at the inflection point of is as the data really becomes liquid, the new business opportunities and all of our opportunities to grow businesses are going to go up exponentially. And so what if you had access to 5 billion claims records a year, updated daily? What could you do with that data? Well, that's becoming available across Appervita. What if you had access to 70 million lives worth of EHR data, today updated daily, next year updated in real time? 70 million lives, it's not bad. So the problem is you probably don't have the infrastructure. Trust me, we've burned out 40 terabytes of disk in the last quarter trying to deal with big data sets, and it's a pain in the ass to deal with big data sets. So, but what if it was just available as a service to you? That's the kind of transformation that's coming, and so that's going to be fairly radical in terms of the kind of businesses I think we can create around it. So, and so today you have to do it system by system or find. In the next couple of years, you'll be able to get access to big data sets. The second part of the question was?
Well, the second part of the question was, providers have a lot of sources of
noise in the data.
Right? How does one standardize filtering that out?
This never, well, this is probably good. This is true in every industry I've been in, so they're all analytics and data companies. Every industry goes through this life cycle, and it takes 3 to 5 years. We're probably 2 years in. Unless you use the data, it's of crap quality. It's axiomatic, okay? If you don't use the data, it's crap. Only until you use the data does the data become any good. People are now trying to figure out how to actually use the data to make decisions. And you know what? So the number one request on our platform from end users, interestingly enough, has been sort of silly, it's show me which data is bad so the staff can fix it. And it's making it visible because they know that if it's now sending alarms and they entered the blood pressure, systolic, diastolic in the wrong order, which happens, then if they don't fix that human-entered data, now the problem today is a lot of the data we're dealing with is human-entered, so it's got lots of problems. But they'll never get frontline staff to fix that, or even the machinery to fix it unless they're going to use it. And so we're now beginning to enter the next 3 to 5 years is when people are going to want to use the data to do lots of things and marked improvements in their business. So when that happens, that data quality goes away. But we're going to have to live through it. You can't get around this in any industry. We're just going to live through it.
2 more questions, and then we'll allow anyone that wants to see Paul afterwards to get a few minutes with him. But one, how do you price the algorithms or the analytic applications that are on the platform, especially because, the question said some of the publishers sometimes overvalue their analytics major, their IP. So how do you price it?
So when we started, it was bimodal, completely bimodal. They wanted to give it away because they were in the business of social value, or they thought it was worth $1 billion, and there was nobody in between. Okay, so their algorithm was literally worth $1 billion.
Did you actually have anyone put $1 billion into the
The discussions we had, people would say, well, this is going to be worth $1 billion because it's going to, blah. That okay, but it was bimodal, and by the way, I would say more people erred on the side of it ought to be free. Okay, because our job in medicine is to promulgate knowledge, create and promulgate knowledge, and therefore it's important that everybody has it. Say, well, didn't you just spend a lot of your institution's money? And so what we've had to do is work people to the middle and to help them. So we don't establish price. Okay, we provide some models so people can help assess what the pricing ought to be, but ultimately publishers set completely their own price. Okay, now what we try to do is coach them through just a set of tools that said, it ought to relate to economic value. And one of the challenges we face, particularly on the clinical side, not true necessarily in RevCycle and others, but on the clinical side, it's not clear how you measure value because they measure it in people's lives today, and the pharma industry's gotten unfortunately good at assessing value, but in the clinical side, they haven't done that yet, and so we're trying to help them figure out what a reasonable return is for the kinds of things. So I'll give you a simple example. Dr. Edelson's algorithm, which I talked about before, is just a good example. So 220,000 people a year have a heart attack in a hospital. 80% of those people die. Her algorithm is 90% effective at interdicting that early and substantially reducing that number, okay? Substantially reducing it. Well, it turns out that has a big economic savings, okay? If you don't have a heart attack, think about the cost of rehabilitation. So how much of that value should she capture and well, it turns out even though she can sell it, the insurance company gets a lot of that value, right? And not the hospital. Right. And so the hospital won't pay. So you have to really figure out how to, so the short answer to the question is it's not easy. We're trying to work people to the middle and create some market. Nobody knew what an e-book was worth until Apple fixed the price. We won't be in that business, but we're trying to help the market figure out what it's worth.
Last question is actually a question Paul asked me earlier tonight.
Uh-oh.
Great question. It was, are you motivated by not losing or by winning? I think you got a more articulate way of phrasing it.
Yeah. So do you hate to win or hate to lose? And I found it's an interesting way to differentiate people, particularly salespeople, when you ask them the question, because they don't necessarily think of their motivation. And I find there's 2 very different types of people. And some you want to sort of. You'd like to you live in the middle, and the question is which one do you really do you survive? So I hate to lose. I don't love to win. I mean, I like winning, but I want to go on to the next deal where I might lose. And so I tend to be motivated by not losing rather than the love of the win. And I know people who love the win, so there's people very much on the other side of that.
Yeah.
They relish it, the win. I hate the loss. So what about you?
Well, I don't know. This is one that you keep going on it, right?
I know.
It's meta. When he asked me the question, when Paul asked me the question, I thought, boy, I remember in the early years, survival. And it just got
big motivator,
full engagement. Very big motivator, right? And you're not just working tirelessly like we all have because, you just want to nobly do the best you can do every day, right? You're just trying to survive. You're trying to stay alive. There's something very visceral about that.
Yep.
I've talked a lot about it to a lot of entrepreneurs. And then there's an adjustment period once you've survived in some capacity to get back to full engagement.
Yeah.
So that made me think, I bet the answer might be, I hate to lose. But then, then now you're thinking, I don't know, because I find myself willing to put myself in situations where I might lose because I'm chasing the win.
Yeah.
So I don't know. It's very abstract, kind of neat question for us all to end on and think about and get.
How many people here love to win? Raise your hand. Hate to lose?
Going in on the win.
Ooh, that's not what I expected.
Right?
Interesting. Okay.
Now, would you say a salesperson, since you mentioned that, has an edge in an interview if they answer one way or the other?
It helps me understand.
Manage them.
It helps me understand their style and how to manage them,
Yeah.
and what motivates them.
Very
So,
interesting.
and there's different behavior sets that go
Right.
along with the two. So,
Well, great. Time for we'll pick that up the next time we talk. Thank you again, Paul, for joining us. This was a lot of fun.
thank you, Rishi.
Thank
Enjoyed
you,
it. Cheers. Hello, Charlie. How are you? I'm going to turn this off.